Okay, withdrawal symptoms. As you know, antidepressants can help reduce anxiety, low mood, and suicidal thoughts. The medication works by changing the way in which the brain uses chemicals to balance mood or deal with stress. Antidepressants cannot cure depression, but they can reduce its symptoms. Now, when you're prescribed antidepressants, they're usually just for 6 to 12 months. That's a general prescription. And then you go in like milligrams every couple months. You might up the dosage for that first year to see how it works. And a person may choose to stop taking antidepressants for a variety of reasons, right? Side effects are too difficult to manage. Like for me, I can no longer really feel my neck. I don't know what kind of pill I was on, but I have never-ending neck pain. The expensive medication, if they're not covered, antidepressants can be very, very expensive. You can go with the generic brand, but I wouldn't really advise it. Recovery from depression. Advice from a medical professional. If your psychiatrist is telling you to get off antidepressants or try a different one, it would be in good taste to listen to what they say, right? Because they know. Or if you're pregnant or planning to become pregnant, this kind of stuff aren't good for a baby. Now, on the flip side, it's pretty difficult to stop taking them if you've been taking them for a long time. If you want to get off of them after you've been taking them for like, I don't know, let's say like a year or 2 years, talk to your doctor and get advice and support on slowly coming off of your antidepressants. You don't want to just come off with a snap of your finger. That'll put you in the hospital, most likely. With how bad a withdrawal can be from just doing that, you don't want to put yourself in that situation. Fact. Up to 80% of people will experience symptoms of withdrawal when they stop taking their antidepressants suddenly. Gradually reducing the dosage can help reduce or prevent the withdrawal symptom. There are different types of antidepressants, and they all have different types of withdrawal symptoms. And I'm going to give some examples. Serotonin, or selective serotonin reuptake inhibitors, SSRIs. These include medications such as citalopram, paroxetine, fluoxetine, and the withdrawal symptoms can include stomach cramps, flu-like symptoms, dizziness, ringing in the ears. That can explain a lot, because I used to get a lot of ringing in my ears when I got off of my sertraline. Difficulty of movement. Yeah, I've experienced that too. And seeing, hearing, or smelling something that's not there. It's also important to note that you may experience symptoms that make it feel as though depression is returning. And these can include anxiety, mood swings, suicidal thoughts, mania, or poor concentration. Just keep that in mind. The next one, monoamine oxidase inhibitors. Short form MAOIs, like MAOIs. So MAOIs include medication such as phenelzine, selagiline, and isocarboxade. Withdrawal symptoms can include, disruptive sleep, feeling agitated or irritable, hallucinations, feeling very tired, difficulty thinking, feeling unsteady, or having difficulty moving. The next one, I can actually pronounce this one properly. Tricyclic antidepressants, or short form TCAs, right? TCA medications include amitriptyline, imipramine, and desipramine. Among others, withdrawal symptoms can include low blood pressure, flu-like symptoms, anxiety, difficulty sleeping, feeling restless, fast or irregular heartbeat. This makes me wonder if my last set of medications that messed up my heart was in this category. I should go check. It's in my cupboard. Because I took these pills for like a month and then I ran out. I couldn't get a refill. And I ended up going to the ER for like how many days a week because my heartbeat was so messed up and I couldn't breathe and stuff. I should check. That would actually make sense. Now, the universal question, why is stopping hard? Stopping any medication is hard, and no matter what it is, antidepressants, Tylenol for pain after a car crash, any other really medication you've been taking excessively, it'll have side effects when you come off of them. Medication for depressants, it makes changes to the chemicals in your brain. The body adjusts to these changes, so immediately stopping medication can cause a reaction, which is better known as withdrawal. Antidepressants are not addictive, so it is not an actual withdrawal. Addiction means that a person is reliant on it to the point of lacking control and not being able to stop taking it even if it's causing harm. This usually occurs with substances such as alcohol or specific drugs. So for this reason, the medical term that they made for it is called antidepressant discontinuation syndrome. This is for when you're going through withdrawal from antidepressants. It can be both emotionally and physically challenging to stop taking antidepressants. A person may worry that symptoms of depression will return. I've been on the receiving end of that. It can suck too. You just have to pace yourself and take your time with it. So which antidepressants are harder to stop taking? Is there a certain one? Let's see. So stopping different antidepressants will result in different withdrawal symptoms. As you remember, when I went through the certain sets of antidepressants and symptoms above, antidepressants with a short half-life can cause more side effects and be more difficult to stop taking. The half-life is the amount of time it will take for the level of the substance in your body to reduce by half. And this can vary from person to person. Again, right? Not everyone is the same. Antidepressants with a short life include venlafaxine and trazodone, while fluoxetine and citalopram are among the antidepressants with a long half-life. Antidepressants with a longer half-life generally cause fewer side effects. However, this does not mean that people will not experience withdrawal symptoms when they stop taking them. So, how can you relieve symptoms? Withdrawal symptoms usually appear within a day of stopping an antidepressant. Being aware of possible withdrawal symptoms beforehand can help a person to prepare for them, right? In some cases, severe withdrawal may make it necessary to take some time off of work because your body's out of whack. It's adjusting to not being on a medication. You might get really sick and you might not be able to move, maybe temporal paralysis. That happened to me too. So choosing a suitable time to stop taking antidepressants can help you with withdrawal. A person may be more at risk of relapse of depression during periods of stress or emotional difficulty. So, example, don't get off antidepressants when it's the holiday season and you gotta do all your Christmas shopping because you're asking for a relapse. You know, it's possible to treat flu-like symptoms in the same way as drinking plenty of fluids, getting rest, staying warm. Those can all help. Taking pain relievers to ease any discomfort is usually safe, but make sure you check with your doctor first because, you know, the antidepressants are still in your system. You don't want to mix it with something you shouldn't be mixing it with. But it's important to note that if the symptoms of tiredness, disturbed sleep, and irritation affect your day-to-day activities and make it more difficult, planning a quieter few days while stopping antidepressants can reduce stress. Again, back to my other point, don't do this in the middle of the holiday season, right? Do it maybe during the summer, you know, if you have kids, they're off of school, they can go play, go to camp or something, you know, when everyone's out the house. Try and just take it easy, don't overexert yourself, right? It can also be difficult to tell the difference between discontinuation symptoms and relapse. If a person's concerned that the depression is returning, they might wish to seek medical advice. Go back to your doctor, go back to your psychiatrist. In some cases, a doctor may prescribe medication to help with withdrawal symptoms. If I remember right, I think Prozac helps with withdrawal symptoms. But we might get to that at the end of the video. Discontinuation symptoms tend to last for 1 to 2 weeks, but can last longer in some cases. For me, I think the longest was like 2 months. Having a good support network in place or someone understanding to talk to during coming off of your medication, it can be beneficial. You feel like you wouldn't be alone. Getting sufficient rest, eating well, and doing exercise can reduce symptoms for some people too. Exercise is very good if you're getting off of any form of antidepressant. Okay, tips for stopping safely. Stopping antidepressants is a serious decision that can affect a person's health. You know, a doctor is the best person to talk to when you want to stop, right? But you know, there are benefits and risks to taking, you know, a variety of medications, right? This is also the case for antidepressants, right? It's essential to consider both the positives and the negatives before deciding to stop taking an antidepressant. Although, you know, it's always possible to reverse the decision too. It's just going back on them while you're in the middle of a withdrawal. It can be kind of nasty, right? You might not feel the same for a couple of months if you do something like that, right? Now again, you know, the doctor can advise you what you need to do and how to stop taking your antidepressants gradually and safely, right? Though that's called tapering, is when you slowly reduce your dose. That's what I did. Don't go right off. I tried that too with my very first one. Yeah, nasty. But I tapered my last two, and it helps because you're slowly reducing what you're putting into your body can kind of readjust. So even if you choose to go back on or take a different one, it won't be as bad. Now, it's also important to note that with tapering, the length of time usually depends on how long you've been on the medication. So if you've been on it for a year, then most odds are you're probably going to end up tapering for a whole year till you get down to no more. But again, talk to a doctor to work out these things, right? You don't want to just go straight and do it, or like, you know, be your own doctor. I know that a lot of people are stubborn when it comes to that too. Now, if withdrawal symptoms are severe, it may be possible to switch your medication, right? Antidepressants with short half-life are generally more difficult to stop taking. Therefore, switching to an antidepressant with a longer half-life and then gradually doing your tapering may help with withdrawal. It might take longer, but it could help in the long run, and it might even be better for your body. But remember, any decision you do, you should seek support from your friends, family, a support group. If you go to like see a therapist or something, talk to them and, you know, get that support, get your advice to stop taking your antidepressants safely, because you don't want to put yourself in a situation of withdrawal. It can be nasty. So as we come to the end of this video, the last couple of things are going to be generally how I end most of my videos on these kind of talks. You know, treatment for depression is often most effective when people use a range of methods. These typically include, you know, your medication, therapy, exercise, peer support, maybe group support. You know, you may continue to use other treatments for depression after you stop taking your antidepressants, right? That's we come into finding your coping methods, what to do to help you ground yourself, and things you can do without having to go and put yourself back on medication. Like, there's a wide variety of things you can do, right? It's just a matter of being self-aware. Being self-aware is very important when you're battling a mental health condition. And it's also important to note again that withdrawal symptoms from certain medications can lead to suicidal ideations. If this happens, seek support. There's numbers you can call, or go straight to the emergency room, whatever you need to do. And it's always good to talk to someone who's supportive, a friend, a loved one, because they'll know what to do. Right? You're not in this alone. Just remember to do everything the safe way. Don't try and be your own doctor. There's support out there for you, and you're not in it alone. And with that, I thank you guys for tuning into the video, and I'll see you in the next one.